The CDC is announcing it has now shortened the recommended quarantine time for some types of infected patients.
This is certainly big news. Here is a breakdown now of your top 10 COVID-19 headlines. Patients who are asymptomatic will have to isolate for 5 days, followed by 5 days of wearing a mask around others. That's the recommendation under this new guidance. Previously, the isolation period was 10 days. Individuals who have received their booster shot do not need to quarantine following an exposure, but should wear a mask, they say, for 10 days after exposure.
And the other big headline today, pediatric hospitalizations for COVID-19 in the U.S. are surging to their highest levels since early September. In fact, across the country, some 2,000 children have been hospitalized with either confirmed or suspected cases of the virus. Now, that is up roughly 60% from just a month ago. On average, about 260 children are being admitted to the hospital every day. And after gathering with friends and family for Christmas, a lot of folks lined up today to get tested for COVID as the Omicron variant continues to surge. ABC 13's Courtney Carpenter is live at a testing site in Southwest Houston right now. And Courtney, give us some sense. How is the line looking?
Hey, good evening, Mel. Yeah, we're here in the Maplewood area just off Beechnut, and actually we just watched them turn the lights off just moments ago, closed right at 6, but several people got turned away, weren't able to get the test that they came here for, and already online, there are no tests available at this location tomorrow or Wednesday. We know it can be frustrating waiting in a long line or not being able to find any at-home tests, but doctors say if you're having any of the COVID symptoms, it is the best thing to do.
Probably over an hour.
A post-holiday nap sure sounds nice, but across the city today, people are spending their time in lines waiting to get tested for COVID.
All I can do is wait. I've been several places and it's the same.
With at-home tests being hard to find,
Last night I was out till about 9 o'clock, couldn't find any at-home tests.
lines looked like this at Plaza Americas, and you can see it was busy at the HCC Southeast testing site too.
We are all frustrated by the limitation in outpatient testing. There are several initiatives in place to get more test kits into stores, but we won't start feeling those for another few weeks.
Dr. Linda Yancey with Memorial Hermann says early indications show the Omicron variant, though more infectious than Delta, may have milder symptoms.
It sounds strange to say it, but a less severe disease that is more infectious than Delta is a good thing because fewer people are getting seriously ill. Now, that being said, we still have a lot of people in the hospital right now. Folks still need to take precautions.
If you've got congestion, a sore throat, or runny nose, those are the common COVID symptoms, and you should go get tested, though likely it'll take some time.
Well, it's frustrating, but I think being safe is better than being sorry because it's real serious.
Of course, the alternative to those long lines are at-home tests, and they are supposed to become more available soon. So we reached out to state officials to see if and how positive results from at-home tests are going to be tracked and if they will be added to the number of cases in the state. Turns out they won't be. Just the results of testing done by a lab or through a healthcare provider are actually the only ones required to be reported to public health. Reporting live in Southwest Houston, Courtney Carpenter, ABC 13.